For the enteric kits, we're talking about enteric bacteria. What we're providing is the instruction sheet on how to collect the specimen, a specimen transport bag, a metal container, and a cardboard mailer to mail it back to us. And the media is what you'll see on the bottom right-hand corner of the screen here is a Carey-Blair media, which is a general enteric bacteria culture medium. And the swab is actually attached to the cap. These are stored at room temperature, and they're good for 6 months. And for enteric kits, please keep in mind that these are not for viral norovirus testing or for parasite testing, strictly for enteric bacteria. So the stool is actually being preserved in a bacterial transport medium. So if you're ever unsure of the test request or the type of sample to collect, it's a really good idea to be in close communication with your hospital doctors or your state or local epidemiologists. Or you could always just call the laboratory for assistance. For the influenza kits, we are giving you a micro-submission form, an MP swab, instruction sheet on how to collect the MP swab, and a specimen transport bag. The media in this case is either the Hanks Blue Top or Universal Viral Transport Media, which you can see on the bottom left. These are stored at refrigerated temperatures, and they're good for 2 months. You'll see the swab at the bottom right-hand corner of the screen. And the difference between the Hanks Blue Tops and the Universal Viral Transport Media, the Hanks Blue Tops really we're just making in-house, and the Universal we're purchasing. So as we saw during the 2009 swine pandemic, everybody was purchasing the viral transport media, and we had to go back to making this in-house. So it's the same thing. The only real difference is the one we're making in-house has a shorter shelf life. Okay, for Leptospira culture media kits, the contents are going to be the Leptospira media and an instruction sheet. Currently the media is the EMGH, and we are soon to be changing that to a Fletcher's media, but either one will work that comes with the kit. These are stored at refrigerated temperatures, and they're good for 6 months. And it's important to note that we don't routinely ship these kits out. They're only available when you're absolutely ready to collect your specimen. Okay, for ONP, or ova and parasite kits, you are getting an instruction sheet on how to collect the sample, a specimen transport bag, metal container, and cardboard mailer to mail the 2 media tubes back to us. And you'll see the 2 media tubes at the bottom right-hand corner. It's our PVA and 10% formalin. These are good at room temperature, and they have a little bit longer shelf life of up to 2 years. For pertussis kits, again, you're getting a micro-submission form, an instruction sheet on how to collect your MP swabs. You're getting a polyester MP swab and media. And the media in this case is a Regan-Low auger tube or slant. These are kept at refrigerated temperatures and good for 2 months. We're currently in the process of bringing on board a pertussis PCR. So if the specimen or shipping requirements change in any way, we'll send out a notification. The only thing that might change is the type of swab that could possibly inhibit the PCR. For tuberculosis kits, we are giving you a 50 ml sputum collection vial. Sometimes this is referred to as a Falcon tube. That's because of the brand on the collection vial. We're sending you the metal container and cardboard mailer. So there is no media in this case. It's really just the sputum in the vial. And what you want to do is collect the sputum in the vial, wrap that up with some type of absorbent material, which we're also providing half of a paper towel. A lot of things can work for absorbent material. It can use cotton balls, newspaper, paper towels, but you want to put the absorbent material around the sputum collection vial and then put that inside the metal container. And then you want to put your sample submission form around the metal container and put that in the cardboard mailer. That's so if there is a leak in any way, either the absorbent material is absorbing the leak and you have your submission form on the outside of the metal container so that it wouldn't get contaminated if something leaked. There is no shelf life for these. Okay, in order to obtain any of these supplies, you can call our receiving department and they can take your order, or you can email them or visit the website. Please keep in mind that if you're placing your order, please place it at least 5 days in advance to when you need it. All right, for our microbiology submission form, the current version is available at the website listed at the top of the screen. The current version is a fillable PDF, which allows you to keep electronic records, and it also lets us only print what's necessary. We do want to say that if you are sending a sample, each sample needs to have its own submission form. If you've chosen the appropriate sample, you can choose more than one test per sample, but each sample needs its own submission form. All right, here is a screenshot of the current submission form version. There are additional epidemiological and demographic fields added to this, as well as we've removed some tests that are no longer performed and added some tests that we've currently brought on board. The fields that are highlighted in yellow are going to be required fields, and you'll see at the bottom of the screen in red lettering are organisms or test requests that are going to require prior notification before submission. Okay, so yes, the current version does have additional demographic and epidemiological fields, and we will accept the older versions, but if you could please implement the necessary changes to start using the latest version as soon as possible, it would be the most beneficial. So the website, again, is at the bottom of the page.